8:14, how important are your eyes to you? Arguably very important. Important enough that you're staying on top of your eye exam every year? That's the question. Our favorite eye doctor, Dr. Kimberly Friedman, is here, an ophthalmologist. And we're talking this morning about the fact that our eyes are really the windows to our overall health, correct?
Right. The eye is one of the only places that you can actually see the blood vessels and nerves of the body, which respond to many diseases. And you can see that just by dilating the eyes and having an eye examination.
Now, you've had patients come in complaining about blurry vision, for instance, and because of that, you've been able to diagnose them or take the first step toward diagnosis of diabetes.
Right. You know, eye exams are not just for glasses or contact lenses. When we look at the eye, very often we'll see signs of eye diseases. And one of the most common that we see is actually diabetes. Diabetes is actually diagnosed through eye doctors more than any other type of a doctor.
When you have fluctuations in blood sugar, when it goes up, when it drops back down, that leads to temporary blurry vision, correct?
Right. If a patient comes in saying that they're clear one minute, blurry the next, clear in the morning, blurry after a big meal, we immediately start thinking diabetes. That's one of the #1 early warning signs of diabetes.
Yeah, I often talk about the fact that I'm a type 1 diabetic, and the great concern long term when it comes to diabetes is complete loss of vision due to diabetic retinopathy. Is there a way to make our audience understand just exactly what retinopathy is?
Right. Diabetic retinopathy is essentially when the blood vessels become leaky. Diabetes causes the blood vessels to leak. Leaks both blood and fat into the retina. When they leak into the retina, what happens is the retina almost attaches in those little areas where the leakages occur, and then you lose your vision in those areas. It's the #1 cause of blindness in the United States in adults, diabetic retinopathy.
Which is why it's so important to get your eyes checked every year, particularly when you're diabetic, because
Right.
there are good, new, effective treatments for this, correct?
Right. Diabetic retinopathy in its early stages is completely treatable. We use different lasers to treat the disease in its early stages, but once it gets to a more advanced stage, it becomes much more difficult to treat. That's why an annual eye examination with a dilated retinal examination is so important.
And it's important for all of us, not just diabetics.
Exactly.
But if you are diabetic, keep your blood sugar under control and get your eyes checked. Carrie Lee?